Dear viewers, greetings. In this video, we are going to see about the bacterium Klebsiella pneumoniae. First, general characteristics of Klebsiella pneumoniae. The bacterium Klebsiella pneumoniae is a gram-negative rod-shaped bacilli and it is non-motile in nature and its size ranging from 0.3 to 1 micrometer in diameter and 0.6 to 6 micrometer in length. It belongs to the family Enterobacteriaceae. Capsules are present and made up of polysaccharides. Endospores absent, and the Klebsiella pneumoniae is categorized into two serotypes. They are K1 serotype and K2 serotype. The mode of respiration observed in Klebsiella pneumoniae is aerobic or facultative anaerobic. And the optimum temperature required for the cultivation of Klebsiella pneumoniae is 35 to 37 degrees Celsius and optimum pH is 7.2. And regarding the habitat, Klebsiella is a common opportunistic pathogen for humans and present particularly in the gastrointestinal tract. Other habitats includes sewage, drinking water, soil, surface water, industrial effluents and vegetation. In recent years, Klebsiella have become an important pathogen in nosocomial infection. The genus Klebsiella was named for German physician and bacteriologist Edwin Klebs, who was an assistant of Rudolf Virchow, and he was also known for its discovery of Corynebacterium diphtheria. Rudolf Virchow was very well known for the cell theory concept, and in cell theory concept he proposed that one cell can arise from the pre-existing cells. And the Klebsiella pneumoniae is also called as Freilanders bacillus. It was first described in 1882 by German microbiologist and pathologist Karl Freilander. Disease transmission of Klebsiella pneumoniae. Klebsiella pneumoniae can be spread through person-to-person contact via the contaminated hands of healthcare personnel or other persons. Klebsiella pneumoniae less commonly transmitted by contamination of the environment, and Klebsiella is spread very easily and rapidly, but not through the air. Virulence factors of Klebsiella pneumoniae. The ability of the microorganisms to cause an infection is called as virulence, and the term virulence was first coined by the scientist Louis Pasteur. Virulence factors are the factors which are responsible for causing an infection in the human beings or any other host cells. And here the Klebsiella pneumoniae have 6 virulence factors. The first virulence factor is cell wall receptors. The second virulence factor is fimbriae, which is responsible for adhesion or attachment. And the third virulence factor is capsular polysaccharides, which causes sepsis, antiphagocytic in nature and resist complement mediated killing. And the fourth virulence factor is lipopolysaccharides, which act as a endotoxin and causes sepsis, antiphagocytic in nature and resist complement mediated killing. And the fifth virulence factor is capsular antigen, which is antiphagocytic in nature and inhibits the macrophages. And the final and sixth virulence factor is aerobactin, which act as a citrophore-like ion chelating agents. And the incubation period for Klebsiella pneumoniae is 1 to 6 weeks, and the infective dose required to cause the infection is variable. Pathogenesis of Klebsiella pneumoniae. Klebsiella pneumoniae is pathogenic and is responsible for a large number of infections every year. The capsular polysaccharides, lipopolysaccharides, and capsular antigens are the common virulence factors of Klebsiella pneumoniae. The main virulence factor in pathogenic Klebsiella pneumoniae strains is aerobactin, which is widely produced by the K1 and K2 serotypes, which is also the main virulence factor. And the common symptoms of Klebsiella pneumoniae infection in the blood includes fever, chills, rash, and lightheadedness or faintness or dizziness. The infections in the lungs can lead to pneumonia and can result in breathing problems. The most common treatment for Klebsiella pneumoniae infections are antibiotics, but recent strains have been found to resist many common antibiotics. In a recent study, hypervirulent strains were responsible for the deaths. And next, clinical diseases of Klebsiella pneumoniae. Klebsiella pneumoniae results in 7 clinical diseases. They are pneumonia, urinary tract infection, skin or soft tissue infection, meningitis, endophthalmitis, pyogenic liver abscess, and bacteremia. The first clinical disease caused by the Klebsiella pneumoniae is pneumonia. Klebsiella pneumoniae often causes bacterial pneumonia or infection of the lungs. Pneumonia happens when the bacteria enter into the respiratory tract, and the symptoms of the pneumonia includes fever, chills, cough, yellow or bloody mucus, breathing trouble, and chest pain. The second clinical disease caused by the Klebsiella pneumoniae is urinary tract infection. Urinary tract infection do not always cause symptoms. If patients do have symptoms, patient might experience frequent urge of urine, pain and burning when urinating, bloody or cloudy urine, and discomfort in lower abdomen. Urinary tract infection in kidney might have fever, chills, nausea, vomiting, and pain in the upper back and side. The third clinical disease caused by the Klebsiella pneumoniae is a skin or soft tissue infection. If Klebsiella pneumoniae enters through a break in the skin, it can infect the skin or soft tissue. Usually, this skin or soft tissue infection happens with wounds caused by injury or surgery. Klebsiella pneumoniae wound infection includes fever, redness, swelling, cellulitis or swollen and red skin, necrotizing fasciitis or flesh-eating disease, and myositis or inflammation of muscles. The fourth clinical disease caused by the Klebsiella pneumoniae is meningitis. The Klebsiella pneumoniae can cause bacterial meningitis or inflammation of the membranes that covers the brain and spinal cord. Meningitis happens when bacteria infect the fluid around the brain and spinal cord. Symptoms of meningitis are high fever, headache, stiff neck, nausea, vomiting, photophobia, and confusion. The fifth clinical disease caused by the Klebsiella pneumoniae is endophthalmitis. Klebsiella pneumoniae is in the blood. It can spread to the eye and causes endophthalmitis. The endophthalmitis is an infection that causes inflammation in the white of the eye, and the symptoms of endophthalmitis includes eye pain, redness, white or yellow discharge, white cloudiness on the cornea, photophobia, and blurred vision. The sixth clinical disease caused by the Klebsiella pneumoniae is pyogenic liver abscess. Often, Klebsiella pneumoniae infects the liver. This can cause a pyogenic liver abscess or a pus-filled lesion. Klebsiella pneumoniae liver abscess commonly affects the people with diabetes or who have been taking antibiotics for a long time. Common symptoms of pyogenic liver abscess includes fever, pain in the right upper abdomen, nausea, vomiting, and diarrhea. The final and seventh clinical disease caused by the Klebsiella pneumoniae is bacteremia. In primary bacteremia, Klebsiella pneumoniae directly infects the bloodstream. In secondary bacteremia, Klebsiella pneumoniae spreads from blood to all the parts of body. Symptoms of bacteremia are fever, chills, and shaking, and the bacteremia needs to be treated immediately. If left untreated, bacteremia can become life-threatening. Laboratory diagnosis of Klebsiella pneumoniae. The first diagnostic method is microscopic examination. Under gram staining, the Klebsiella pneumoniae was observed as pink-colored gram-negative rods. In motility test, non-motile cells were observed, and in negative capsule staining, unstained capsules under black stain background was observed. This image shows the gram staining of Klebsiella pneumoniae, and this image shows the negative capsule staining of Klebsiella pneumoniae. And next, colony morphology on culture medium. In nutrient agar, Klebsiella pneumoniae colonies are mucoid, circular, 2 to 3 mm, dome-shaped, grayish white, transparent to opaque colonies. In Mechanchi agar, the Klebsiella pneumoniae shows mucoid, pink-colored, lactose-fermenting colonies, and in blood agar, mucoid, non-hemolytic colonies or gamma-hemolytic colonies were observed. This image shows the mucoid colonies of Klebsiella pneumoniae in nutrient agar, and this image shows the mucoid colonies of Klebsiella pneumoniae in Mechanchi agar. Biochemical test for Klebsiella pneumoniae. Catalase positive, oxidase negative, urease positive, indole test negative, methyl red test negative, Voges-Prescott test positive, citrate utilization test positive, TSI test shows acid bud, acid slant, no gas and no H2S. Lysine T-carboxylase test positive, cellobiose test positive, esquilene hydrolysis test positive, acetate utilization test positive, and finally ONPG test positive. This image shows the Klebsiella pneumoniae on triple sugar ion slant, and here acid but, acid slant, no gas and no H2S. The TSI of Klebsiella pneumoniae similarly looks like the E. coli's TSI slant, but the only difference is a gas formation observed in the TSI of E. coli, but here no gas formation observed. Finally, treatment and prevention. Klebsiella infection can be dangerous. So, doctors start treatment with antibiotics right way, and the examples includes aminoglycosides, polymyxins, tigecycline, phosphomycin, temocillin, cephalosporins like cefotaxime and ceftriaxone, and carbapenems like imipenem or cilastatin. And regarding the prevention, the maintenance of high hygienic standards will reduce the risk of infection. Dear viewers, that's all about the bacterium Klebsiella pneumoniae. Thank you for your support. Thank you.